everybody. My name is Jill from Walks, and this is the third in our series of health webinars. And I'm really delighted that today we're going to be talking about arthritis. And our guest speaker is Kelly Harman from Versus Arthritis, and Kelly is the Strategic Program Manager for Physical Activity. Hello there, Kelly. Do you want to give us a wave?
Hello everyone, nice to see you tonight.
Okay, so what Kelly's going to do now, she's going to share her screen. She's going to do a short presentation first. So lots of your questions will probably be covered in during her presentation, but if not, we will take questions at the end. So over to you, Kelly.
Hello everyone, thanks so much for inviting me along tonight to talk to you about arthritis and physical activity. As Jill said, my name is Kelly and I work for a charity organisation called Versus Arthritis. We are the largest UK-wide arthritis charity, and our work is all about supporting people, campaigning, advocating for the right support for people with arthritis. So the aim of this session is to give you a brief rundown of the different types of arthritis and how physical activity can affect people living with these conditions. We do a lot of research, we fund a lot of research, and that's found out that keeping active into an old age prevents many aspects of musculoskeletal decline. And in fact, resistance training is one of the most effective ways to prevent decline in musculoskeletal muscle mass and strength as we age. So I'm really hoping that you'll be able to take some really valid information away with you tonight. If you are a person that is living with arthritis or a musculoskeletal condition like back pain or knee pain, or you might know someone, there might be a family member or a friend that may live with the condition, and it would just help you to understand it a little bit more and how you might be able to support that person as well. So let's talk about what is arthritis then. So arthritis is an umbrella term for a number of different conditions which cause pain, swelling and stiffness in a joint. There are many types of arthritis and related conditions. In this session, we'll start to describe some of the most common ones, which are osteoarthritis, rheumatoid arthritis, gout, juvenile idiopathic arthritis, or short name for that is JIA, psoriatic arthritis, osteoporosis, and lupus.
That's not going anywhere.
So the term arthritis comes from Latin, with the first part of the word meaning joint and the second part meaning inflammation. And we know that there are over 10 million people in the UK that are thought to have arthritis. That's more than 1 in 6 people. Arthritis can affect people of any age as well. So let's just have a look, first of all, at what is osteoarthritis. It's the most common type of arthritis. The most common type of arthritis is osteoarthritis. It's estimated that around 8.75 million people in the UK have seen a doctor about osteoarthritis. Osteoarthritis is more common in women and usually affects people from the age of 45 onwards. The body parts most commonly affected are knees, hands, hips, and the back. So how does osteoarthritis affect people then? When these changes happen in a joint, it can cause pain and stiffness. Joints can become swollen. Soft swelling is caused by fluid being produced in the joint, or hard swelling that are caused by extra bone forming at the edge of the joints. Osteoarthritis doesn't always get worse for people, and symptoms can even improve over time. Others may have several phases of moderate joint pain with improvements in between. The level of joint damage isn't helpful in predicting the pain people will have. Some people have lots of pain and mobility problems from only a small amount of joint damage, and some may have a lot of joint damage with hardly any symptoms. Most people with arthritis can continue with their jobs, although they may need to make some changes to their working environment, especially if it may be a demanding job. And we have seen and we have heard from people that they have had to retire early from their work because of osteoarthritis as well. The emotional effects of arthritis can have just as much impact of the physical symptoms. Severe or long-term pain that affects your daily life and possibly disturbs your sleep can also affect your mood. Inflammatory arthritis is a name for a group of different types of arthritis which have similar causes, symptoms, and treatments. Types of inflammatory arthritis include rheumatoid arthritis, or RA, psoriatic arthritis, juvenile idiopathic arthritis, JIA. Though JIA is only diagnosed in children and in around one third of people with the condition, it will continue to affect them as they grow older into adults. So you may still know people or meet people with this condition. Rheumatoid arthritis is usually diagnosed in people over 40, and PSA is usually diagnosed in people in their 30s, but it is possible for adults of any age to get these conditions. Rheumatoid arthritis, psoriatic arthritis, and JIA are all autoimmune conditions, but not all types of inflammatory arthritis are. The immune system is the part of the body that helps to protect us against illness, viruses, and bacteria. But instead, the immune system attacks a part of the joints in the body, causing inflammation or swelling inside the joint. Osteoarthritis causes stiffness in the mornings, but this will usually last less than 30 minutes, whereas inflammatory arthritis stiffness can last for more than an hour. So how does inflammatory arthritis affect people? Well, we know that it can cause inflammation in the joints, which causes swelling, pain, and stiffness. We know that people can experience flare-ups, which are periods where the condition gets worse and can be quite severe. Sometimes this can be due to illness, but often it can be for no particular reason. Fatigue can be caused by inflammation as well as some medications. This is a feeling of overwhelming tiredness that can be cured by rest or sleep. Mood can be affected generally by feeling low because of condition or because of pain,
I saw someone late already as well.
sleep patterns, or causing fatigue. Anemia can be caused by the condition itself or by medication for it. This can cause people to be pale, lacking energy, and be more at risk of illness. Other body parts can be affected as well from this. So we have seen instances of heart and other organs and tendons. So how do we diagnose, or how is arthritis diagnosed then? Let's have a little look and talk about this. So as I've already said, we do see some daily variations in pain associated with an underlying disorder. So as you can see from the screen, a person that's been diagnosed with osteoarthritis, their pain generally may come on as the day progresses, and actually they may wake up feeling okay and not too bad. Whereas with an inflammatory condition, they're likely to feel quite when they wake up, feel quite a lot of pain, and actually as the day progresses, that pain will ease as the day goes on. So do you need imaging to diagnose osteoarthritis? Most people think that actually in order to be diagnosed with osteoarthritis, you do need to go and have a scan done. But actually, by having a conversation with your GP or a healthcare professional, and by them understanding your health history, they can diagnose osteoarthritis without having any investigations done. It is a clinical diagnosis, and diagnosis doesn't need to be confirmed by imaging. Imaging is used to plan for surgical intervention or exclude other diagnoses. And the degree of osteoarthritis shown on imaging often correlates poorly with the severity reported symptoms. All of the research is increasingly telling us that exercise is the most effective intervention for preventing and managing osteoarthritis, or as sometimes we call it, OA. We know that exercise can reduce pain, improve function, increases mobility, improves well-being, and the benefits of movement outweigh the risks of harm for anyone living with a long-term health condition. And we've seen that through some of the work that we've been doing with the Moving Medicine consensus statement as well. And Moving Medicine are really trying to embed active conversations with healthcare professionals so that they're really supporting their patients with the right information about movement and physical activity. Some of the symptoms that we often see for rheumatoid arthritis include synovial joint distribution, stiffness in the joints, systematic symptoms, swelling of 3 or more synovial joints. Healthcare professionals may perform the squeeze test and it may become maybe positive. There may be a family history of rheumatoid arthritis. There may be a skin rash, and that individual may have been or still be a smoker. And smoking does increase the risk of developing rheumatoid arthritis as well. How is rheumatoid arthritis diagnosed? Well, it's very much based on a patient's symptoms, a physical examination and results of an X-ray, scans and blood tests. The GP will take the patient's medical history and conduct a physical examination to look for swollen joints and check range of movement. Blood tests may be taken and the GP will refer to secondary care. And a prompt referral is really, really crucial to get the diagnosis quickly and get the patient's disease-modifying anti-rheumatic drugs prescribed to help the stop progressing as quickly as possible. So now let's have a look at what some of the treatment is that's available for people with arthritis. So there are a number of drugs that can be prescribed, but the treatments can vary depending upon the type of arthritis someone may have. Painkillers can help with symptoms of joint pain and stiffness. Non-steroid anti-inflammatory drugs, also known as NSAIDs. Don't ask me what that's for, because I'll definitely have to come back and let you know I'm not a healthcare professional. But they are used to relieve pain and can reduce inflammation as well. Steroids are designed to act in a similar way to hormones, and they can reduce inflammation in the body. But we also know that there are a number of therapies as well that can be really effective to support a person with arthritis. So people with arthritis may be referred to a range of healthcare professionals to support them with the management of their condition. Quite often people will be referred to therapy services such as physiotherapy, but we know this isn't the full story, and we know that fitness instructors, exercise professionals, and other experts working in this sector also have a really important role to play in helping people to manage their condition. For example, physiotherapists can examine the joints and help tailor the treatment to a patient's needs. Some physiotherapists are trained in diagnosing and treating joint and muscle problems, and GPs may refer people to specialist physiotherapists rather than a rheumatologist or orthopedic surgeon as well. We often find that occupational therapists will work with people on ways that they can do daily activities without putting too much strain on their joints as well. And they can also provide information on aids and gadgets, as well as splints and support, which can support the hands and wrists. Hydrotherapy is a lovely form of is a lovely way to support the body in water. Unfortunately, across the UK, we don't have that many hydrotherapy pools. So it really depends on where you live and whether or not you have access to a hydrotherapy pool. But hydrotherapy is the use of water in the treatment of different conditions, including arthritis and related conditions. It differs from swimming because it involves special exercises that you do in warm water. I know some of our more local pools are potentially our council pools could be quite cold at the moment, whereas the temperature in hydrotherapy pools is usually around 33 to 36 centigrade. So it is much warmer than a typical swimming pool. And the exercises are usually overseen by a physio or a physio assistant as well. Finally, there is surgery, which usually means a joint replacement may be needed for that individual. This is usually considered only after all of the other treatment options have been tried. We know that there are a lot of barriers that hold people back from being physically active with their condition. And arthritis as a condition can be really, really unpredictable. A person may wake up one morning feeling okay and actually relatively pain free, and the next morning they may wake up in more pain than they did the morning before. So that unpredictability is something that really can hold people back. Another major symptom of arthritis is fatigue, which can affect energy levels. Many people are worried that exercise could make their condition worse and aren't sure what exercises they can do safely, or have concerns about getting the wrong advice as well. And unfortunately, we know that people have been advised by a healthcare professional that actually exercise isn't necessarily good for them, and could make their condition worse, which is not what our research has found at all. As we really strongly recommend people do as much movement as they possibly can do, obviously within the limits of their condition. 7 in 10 people with a musculoskeletal condition would like to be more active though, and that's through a lot of the research that we've been doing with people over the last 5 years. And there's clearly an appetite for and looking at an increased physical activity level amongst our audience. The main motivators for being more physically active include weight management, improved mood, and then improving their condition as well. Other drivers include increasing energy, improving sleep, and building their self-confidence. So let's have a little look at some of the different forms of movement, exercise, and physical activity that we know are good for people with arthritis. And we'll start with strengthening activities. So strengthening muscles around the joint will provide more stability and reduce pressure. Having stronger muscles helps to keep the joints stable and can reduce pain in the joints and the tissues around them. Changes to our muscles can happen very, very quickly, and we notice that you feel weaker or wobbly. You will feel less weaker or wobbly even after a few days of rest if you've been unwell with a cold or flu. This can happen to people with arthritis if they experience a flare-up of their condition as well. Other examples of strengthening activities could be to do Pilates or Tai Chi, or resistance training, so using a band or even some dumbbells, some hand weights are a really great way to add some strengthening activities into your everyday lives. Even just carrying the shopping as well. So if you're going out shopping, it's a great way to add that into your daily lives. People should aim to do some form of strengthening exercise on at least 2 days a week, if possible. But we know that if joints are hot or swollen, it's a good idea to focus on stretching exercises and avoid strengthening exercises until they settle down. Balance and weight-bearing activities. This can really reduce the risk of falls. And we know that people with arthritis can be at higher risk of falls due to the effect this can have on joints and mobility. Swimming is an important activity as it reduces pressure and therefore pain on joints, but needs to be some weight bearing too, particularly for people with osteoporosis to keep their bones strong. Bones grow in response to stimulus. Fitness. So we know that fitness can really help with many symptoms, including it can improve sleep, boost mood, it increases our energy levels, and also it can really support our independence. It also has a lot of benefits for our hearts and our lungs, and can be particularly important for people with certain conditions. Stretching exercises help maintain and improve the range of movement of joints affected by arthritis by improving mobility and reducing stiffness. It's easy to avoid bending and straightening joints through their full range of movement during the day, particularly when people may be in pain, but not moving the joints fully can cause them to become more stiff and painful over time. And this is through the synovial fluid being produced by movement. People may be given these exercises by a physiotherapist, and they're also included in some exercises such as yoga and Tai Chi. And at Versus Arthritis, we have a real range of exercises and for different body parts, which really focus on stretching as well. When doing stretching exercises, people should try to move joints as far as possible and as far as possible that they're comfortable with. And until they can feel the stretch in the muscles around the joints, it's important to keep the movement slow and controlled. And walking with arthritis. So we've done a lot of research looking at sort of the different forms of movement, of physical activity and exercise for people with arthritis. And we know that walking is a great form of exercise for our audience. It can really help strengthen the muscles around our joints and help maintain a healthy weight. It's important to listen to your body and to start slowly and build up gradually. Also consider when you can and are able to walk, and that comes down to thinking about the time of day. As I said before, if you are an individual that has osteoarthritis, you may wake up with pain in your joints, and actually it might be more beneficial for you to think about a walk later on in the day, whereas a person that lives with rheumatoid arthritis may feel less pain in the morning and is able to go out and do a short walk, or as long as they're able to in the morning, because their pain may become worse as the day goes on. Do consider appropriate footwear to be wearing. Obviously, consider and check the route terrain. Also think about any medication that you may be taking or need to take as well. And take notice of flare-ups and how your body is feeling. We always say to people, it's really important that you listen to your own body, because you are the person that knows your body better than anybody else. And poles can really help to reduce the pressure on lower body joints as well. So how to maintain movement during a flare-up then? And this is often a question that we're asked. And actually, should I, keep trying to move my body when I am experiencing a flare-up? So we know that rest is essential when arthritis symptoms become particularly intense, but gentle and slow movement can also help as well. So try not to stop movement altogether. We really recommend trying light stretching in the morning, which could be performed either lying, seated, or standing. Again, listening to your body will really help with knowing what's best for you. Ease your body into exercising and support its recovery. Again, think about the timing of your exercise. And if you need to, if you think about sensible clothing, so potentially, looser fitting clothing and good footwear, particularly if you are performing these standing. And again, listen to your body. Never force movement if it does cause you pain. So at Versus Arthritis, we have a range of resources and content that you can find on our website. We've done a lot of work over the last 5 years to really make sure that people are informed not only about the condition, but also about the different ways that they can be supported, particularly from a physical activity exercise point of view. So we have a lovely booklet, which you can see on your screen, which is called Keep Moving. And you can actually order this booklet on our online shop. And it has some exercises at the back. Again, that's just showing on your screen. Some exercises that you can do in your own time at home to support your condition as well. We also have some really lovely instructional videos as well. This first set of instructional videos is to support people who may have had joint replacement surgery or may be waiting for joint replacement surgery. And we've got 10 different movement and advice videos, and they focus on the hip, knee and shoulder. And we've also got a full body and cardio video as well. We've got a lovely booklet that supports the videos. All of the videos can be found again on our website or through our YouTube channel. They're free to access, so you can access them at any time of day. We have found that people that have done the instructional videos, so for some individuals, they're now not actually requiring joint replacement surgery, which is great. Equally, those individuals that are waiting for joint replacement surgery have found that they've recovered quicker, having done some of the videos before going in for surgery as well. Our Let's Move with Leon series is a really lovely set of videos, which we've got 12 videos with Leon, and you'll find Leon and his lovely mum in those videos. Leon is an exercise professional by background, and the videos themselves will take you through different strengthening exercises. There's a cardio one, there's a video that focuses on balance. There's also a video which Leon teaches us how to get up and down off the floor safely as well. And these videos are also accompanied by a newsletter that we send out on a monthly basis as well. And we've also got a Let's Move Facebook group as well, where we have over 12,000 members actually now. And that group has been set up specifically to support people to be active with arthritis. So we have lots of members giving support to each other, encouragement and motivation as well. And again, the videos of Let's Move with Leon you can find on our website and YouTube channel. Let me just go back. We've also got a stretching series as well. So the stretching series, there are 10 different videos that you can follow along with a physiotherapist called Jay, who's in the videos. And they are There are 7 tailored stretching videos which cover the hands, wrists, spine, feet and ankles, shoulders, elbows, knees and hips. And in addition to these, there are 3 full body videos, and the full body videos are for looking at movements or stretching movements that you want to do maybe in the morning, during the daytime, or for evening routines as well. And then just to help people keep a track of the movement or exercise they're doing, we have something called My Let's Move Tracker. And this is just a way for people to record what they've been able to do, when they've been able to do it, what their goals might be as well, and then also how they're able to potentially reward themselves as well. We also find that this is a really nice way for people to go back and, if they're having a conversation with a healthcare professional, just to show them what they may have been able to do or not been able to do with their condition as well. As a charity partner, we're also part of a national campaign called the We're Undefeatable campaign. And this national campaign was developed by a coalition of health charities, and of which Versus Arthritis are one of those charities. And it's to support people that are living with long-term health conditions to be more active as well. And the We're Undefeatable campaign really works really closely with people with lived experience who are telling their story about what it's like to live with a long-term health condition, but also how they are using movement, exercise and physical activity to support their own condition as well. We also have lots of support which is available from Versus Arthritis. We have a helpline which is free to call Monday to Friday, 9 a.m. to 6 p.m. And our helpline advisors, although they're not healthcare professionals themselves, they are trained to give people support and advice, but also if an individual may be experiencing difficulties with conversations with a healthcare professional, they can give them some tips and hints on how they might be able to progress that conversation as well as signposts to any other support that that individual may need as well. We've got an online community where people share personal experiences and can learn about the successes and challenges others have experienced. We have something called Ava, which is our arthritis virtual assistant, and you can find that on our website. We also have some local groups across the UK that meet and provide that peer-to-peer support, and all available. All of the help is available through our Get Help section on our website. And that is the end of my slideshow.
We've got a few questions. Obviously, one of the main ones that come up, I know when we were chatting before, you said you can't answer individuals. You're not a healthcare professional, and people would need to go for specificity to their healthcare professional. But the key one, I think, for most of the people that have spoken to us and through our instructors is getting that balance between whether you should or shouldn't do something. And you touched on, if you're in a flare up, for instance, then you've just got to listen to your body and be kind to yourself. Is there any time when you would say definitely don't exercise?
I mean, if your joints are really swollen and really hot, then I would definitely be listening to your body and think about resting those joints and resting the body until that inflammation has reduced, and hopefully the pain has started to reduce in that instance as well. In terms of treatment for that, we know that people use hot and cold therapies for that, or compresses for that, and pain relief as well. So again, paracetamol can be quite effective in that instance as well.
And does the weather, another question we've had is, you said choose your time of day. Have you got any advice around the weather and going out in the cold or the hot? Or
Yeah, the weather can really affect arthritis as a condition. We know that unfortunately during the winter times, obviously when the weather is cold and it is wet, people's activity levels does generally drop because actually they may be experiencing more pain because of the weather, and the joints become colder in that instance. So we really advise people to not necessarily not go outside, because we know that being outside can also be really beneficial for people's mental well-being as well. But actually, you may want to think about reducing your time outdoors a little bit and think about movement that you may be able to do inside where it is a warmer environment as well.
Brilliant. And that's quite obviously we do a lot of outdoor exercise, but I know
Mm,
that a lot of our instructors cut the session timing down on really cold days. We also we have a bank of lovely instructors that offer online for our regular people. So if it's really awful and really cold, then we try to make sure that there is some sort of indoor exercise. I think the key thing that I took from your slides is that making sure people at least stretch
yeah.
indoors and do something rather than just sit dead still. Just try and move.
Yes.
We've had a couple of questions, and I know when we touched on this earlier, you don't want to advise about nutrition or supplements, but I think there are some resources, aren't there, on your website, that there's some blogs and things that people can go to about turmeric
Yes, there is.
and that
Yeah.
kind of thing. Do you just want to tell people where they are?
Yeah, so on our website, you can find some information about the positive impact of a healthy diet on arthritis. And that research has come directly from the research that we fund as an organisation. And that looks at diet and nutritional supplements as well. What I will do is, if I can, I'll try and pop a link into the chat, Jill, so that people can directly access that.
That would be fantastic. And Elizabeth has said that there's on the Zoe podcast, they've just done one about arthritis and nutrition. So
Hmm.
there's some more resources there. One person has just come through now with, you said that osteoarthritis pain was worse in the morning, increased throughout the day. Um, so advice to exercise later on seems contradictory. What would you advise? Don't quite understand that question. Do you just want to clarify that question? I think really what you're trying to say, Kelly, is that if you are somebody that is uncomfortable in the morning, that wouldn't be the ideal time if for you to fit in your daily exercise, and vice versa. If
Yeah.
towards the evenings you're starting to ache, then try to get that in during the day. So hopefully that clarifies that question.
And
Um,
I guess just to also note, Jill, as well, people are going to experience pain at different times of the day as well. This is some of the information that we hear from people, but also we know that it can be really varied for individuals as well. So what one person may experience will be very different to another person as well.
Okay, and obviously the clear message that's coming through, as it is with every other condition that we've addressed on our webinars and in our instructor training and everything, is that movement is good, but managing that movement and making sure it's right for you. Is there anywhere people can go and see the research on how it slows the progression of arthritis if you are more mobile as well? You mentioned to me that there was some research and a blog, and
Yeah,
I
there
want to
is.
pop that into to our little um,
Yeah.
chat as well for people to go to, because
Yes.
obviously a lot of our instructors are the aim is to get people as active as possible,
Hmm.
and maybe this will be something they can use to persuade people to get active before they've got any symptoms of arthritis, or if they're just beginning to get some joint pain or joint discomfort, then it will be good
Absolutely.
for us to be able to access that.
Yes. Yeah.
Somebody
No
has
problem.
asked, Is the use of strapping elastic braces helpful, or do they just mask underlying issues? And that was Tim just asked that one.
I don't know, to be honest with you.
You wouldn't be able to answer that.
No, no.
Okay. I think, again, talk to your healthcare professionals. If it makes it easier for you to be active, then that can only be a good thing, but always check with your healthcare professional regarding that, that sort of thing. One of the other things, it's about adapting exercise. I think the whole thing that's coming through all the time, Kelly, is someone saying, you know, if I've got arthritis in my wrist, I can't do a downward dog. And, you know, you're just going to have to adapt, I think, and is the only thing that we can advise on that. If something is painful, as Kelly said, keep moving, but try to avoid the things that aggravate. Did you want to add to that, or have I got that?
No, that's completely right. And you know, if you are attending a session with an instructor, it's really important that you inform that instructor of your condition and just have a chat to them about it as well, because they may be able to provide some really helpful information and adaptations that you can do as well. So you know, don't shy away from having that conversation with that instructor. Because you know, as an instructor myself, I would want to have that conversation with someone so I could give them that help.
Okay. Any other questions out there? We've got another 10 to 15 minutes. If anybody has got some more questions to pop through for Kelly while we've got her here. That can be instructors, that can be those of you with arthritis, those of you who know someone with arthritis, pop them through. Did send a message. Okay, I'm sorry, Francis, I don't know that I saw that one. Have I missed any, Sam?
No, I can't see a previous message from Francis.
Okay, I can hear someone typing away. And by the way, one of our lovely doctors on the team did say that NSAID drugs are non-steroidal anti-inflammatory drugs, Kelly.
There we go.
Thanks to Anne, she's always there for us with our as our medical advisor. So that's good. I don't think I've missed any other chats. If there's anything coming through, please do let us know before we say goodbye to Kelly. Yes, the presentation will be available. What we'll do is we tidy it up, try to remove as many of the noises as possible, and then we will pop it out on our YouTube channel for people so you can share it as well. Hopefully that has been of interest to you all. Do let us know, give us some feedback, and if you think of any questions that you forgot to ask here, then just come back to myself. It's Jill with a G at Walks, which is WALX, and we can pass those on to Kelly and the team. And don't forget to have a look at those resources. Take your time, look at the resources, and if you can, get out walking as many times in a week as you can, and do your strength training twice a week, as Kelly advised, because that's what you need to do. Just keep moving, but don't push through too much pain.
Jill, we do have another message. Is massage helpful?
Kelly, are you still there? You seem to have gone.
I am here. Can you hear me?
Yeah, we can see you. We can hear you. We can't see you. So is massage helpful?
Apologies. I've got a little white dot that shows my camera on, but I'm not on screen. Yeah, massage. It can be really helpful. I think again it's important to listen to your body. If you are experiencing in a flare up and your joints and are hot, then it's probably not advisable to have a massage. But you know, massage can be really helpful for a number of conditions as well.
Okay, well, lots of thank yous, and I'll add mine to that, Kelly. That's really kind of you to come out on a on a Thursday evening to give us that information and point people to where they can find more. So yeah, very grateful for you, and see you all soon. Thank you all for joining us, and thanks for Sam for helping.
Thanks everyone. Have a lovely evening.